That direct connection between technique and outcome is very appealing. Dental students graduate with about $70,000 more debt than med students, despite training for fewer years and earning less on average. That alone should give you pause. Dentistry still offers strong pay, predictable hours, hands-on work, and a clear path to practice ownership. For many people, it's the right call. But it was never on my radar. And once I started breaking down the reasons, I realized they go much deeper than I wanted to be a doctor. If you're deciding between medicine, dentistry, or another procedural field, this might actually help you figure out what fits you. So let's first start with what I did like about dentistry, and the first thing is, of course, the hands-on procedural work, because dentistry is undeniably hands-on. Nearly every clinical encounter involves a physical procedure, not just decision-making or prescribing. You're working inside a very confined physical space. The oral cavity is small, rigid, and highly sensitive, so millimeter-level precision is crucial. You're operating around teeth, bone, nerves, and soft tissue all at the same time. And that alone demands constant hand-eye coordination. I remember when I was in college, my roommate's girlfriend was studying for the DAT, the admission test for dental school. It's the MCAT equivalent for pre-dental students. And there's one section on the DAT, the PAT, Perceptual Ability Test, where you're shown different views of a 3D object, and then you have to mentally rotate it to determine which other perspective matches another angle of that 3D object. And that kind of spatial reasoning of building a three-dimensional model in your head and predicting how it would look from another angle has always felt intuitive to me, and it was even fun when I was doing those problems with her. And like a puzzle, of course, I enjoyed it. If you're watching any of these videos, this probably won't surprise you. Even when I was a kid, I was drawn to working with my hands. I was that kid in school who was just known for drawing cars. And sometimes I'd even draw cars on request for other kids, essentially for their lunch money, $2, $3, until I guess a teacher found out about my budding car design business and shut that down. But at home, I was also always building things, either helping my dad with projects or putting together model cars myself. My dad was an engineer. And when it came to arts and crafts in school, I loved the parts where you actually got to construct something physical, the cutting, the shaping, the assembling, working with physical structure. Now going back to the PAT, some people find that kind of mental rotation incredibly challenging. And I was working with my roommate's girlfriend trying to help her teacher explain it to her, and it's actually very difficult to teach. It's not about memorizing rules, it's about visualizing objects in 3 dimensions and structure and movement in your head. For me, it just clicked. And the truth is, we tend to enjoy the things that come naturally to us. Spatial reasoning, dexterity, and working with my hands. Those were strengths. As I was doing that PAT section, part of me was like,
maybe I should try this DAT test.
But yes, given my interests and strengths, dentistry absolutely fills that box, pun intended. And most dental visits aren't just consults. They involve drilling, preparing teeth, placing fillings or crowns, performing root canals, extractions, scalings, and suturing. Even routine appointments require active manual work. And in dentistry, outcomes depend directly on how well you execute the procedure. This means that poor hand techniques leads to pain, poor fit, or early failure, and precision affects durability and patient comfort immediately. And that direct connection between technique and outcome is very appealing. But this brings us to point number 2, where there is an important distinction that comes in. Liking procedures doesn't mean that all procedural fields feel the same. As I said, dentistry is very hands-on, but it's a very specific kind of hands-on. It rewards repetition, fine motor control, and refinement within a narrow space. You're doing the same core procedures over and over, getting faster, getting more precise, more efficient. There's a very direct feedback loop between technique and outcome. That's why a lot of dentists will describe their work as crafts-like. The quality of the result depends directly on your hands. What I eventually realized is that while I liked using my hands, I wasn't drawn to precision alone. I was drawn to technical challenge and variability. I wanted problems that change, anatomy that changes, and procedures where the situation forces you to adapt in real time and not just get refined. A lot of us are motivated by improvement. We like getting better at something. But once something becomes predictable, the challenge shifts from thinking to execution, and it also becomes more and more automatic. And the reality is that the technical complexity in many surgical fields in medicine can be on an entirely different level. Take something like a free flap in plastic surgery. You're dissecting muscles with its nerves and arteries under a microscope, moving that tissue to another part of the body, reconnecting it to a new blood supply, and then reconstructing the surface with grafts or additional tissue. It's orders of magnitude way more complex. For most people, That kind of surgery sounds almost like science fiction. I know that it sounded like sci-fi to me when I was a third-year med student rotating on plastic surgery. I didn't even know this was possible with modern technology. But for plastic surgeons, just another day in the OR. Dentistry, by comparison, operates within a much smaller anatomical space, and the range of procedural variation is far more limited. And that's not a criticism of the field. It's simply a different kind of technical challenge. From what I understand about dentistry, granted I am not a dentist, many core procedures become highly standardized over time. You get faster, smoother, and more precise, but the fundamental problem remains the same. Yes, every mouth is different, but the range of variation is still confined to a small anatomical space. I realized that I was looking for a field where the complexity keeps expanding, where each case forces you to think, adjust, and solve something new, not just perform something better. And even in something as technically complex as plastic surgery, I was seeing glimpses of certain aspects of procedures becoming more and more automatic for myself, where it wasn't as exciting or technically challenging because you were just getting better at it. It was becoming more routine. And I imagine that bothered me in plastic surgery or certain parts of plastic surgery, and I'm sure it would bother me much more and much more rapidly with something like dentistry. And this can be the difference between enjoying fine motor work and then being pulled towards surgery. Neither is better or worse, they're just different flavors of working with your hands. And dentistry makes that difference very clear. Once you start thinking about it that way, you can see how dentistry can highlight how differently people are wired when it comes to hands-on work. Some people thrive in environments that reward refinement and consistency, while others are energized by variability, technical skill, and complexity. If you're early in training and trying to sort that out for yourself, tools like specialtyquiz.com can help you pressure test it based on your actual interest, strengths, and personality, not just what sounds appealing. Now, that distinction leads to the next aspect that I appreciated about dentistry, which is the lifestyle appeal. It has a reputation of a lifestyle profession, and in some ways that's earned. Compared to medicine, dentistry offers much more predictability, fewer nights, fewer weekends, and generally much more control over your day-to-day hours. The earning potential is strong, especially in private practice, and there's also a very clear path to practice ownership, which is a big draw for many people. Around 73% of dentists in private practice are practice owners, though that number has dropped from nearly 85% in 2005, as newer dentists are becoming owners later in their careers. But still, these numbers are much higher to the declining rates of physician ownership in medicine. All of that sounds appealing, but once you zoom out and think about the reality of doing this day in and day out for decades, that's where things started to shift for me. That brings us to point number 4. Dentistry has a simpler, faster path to beginning your career. Let's break down what those numbers look like. In 2025, about 13,600 students applied to dental school and roughly 6,200 matriculated for an acceptance rate of about 53 to 54%. Medical school had over 52,000 applicants with about 23,000 matriculating, closer to 43%. So yes, dental school has a higher acceptance rate, meaning it's less competitive, but acceptance rate alone does not determine competitiveness. Medical school applicants, on average, have higher GPAs. Dental school admissions use the DAT rather than the MCAT. The MCAT is a 7.5-hour exam covering biology, chemistry, physics, psychology, sociology, and critical reasoning. It is broad, it is dense, and it's widely considered one of the more grueling standardized tests in undergrad education. The average MCAT score for MD matriculants is about a 512 out of a perfect 528, which corresponds to roughly 83rd to 84th percentile among all test takers. Average DAT scores for dental school matriculants are around 20 to 21 out of 30 in each section, which generally corresponds to the 75th to 82nd percentile, depending on the section. The DAT is also shorter and narrower in scope. Then there's the GPA. The average GPA for dental school matriculants is 3.67. For MD matriculants, per WMC data, it's 3.81. That difference may look small, but if you've ever spent time in the pre-med trenches, you know the gap between a 3.67 and a 3.81, that it's meaningful. That can be the difference between a few B's in core science courses and nearly straight A's. The applicant pool is larger and less self-selected, which changes how difficult admissions actually is. There's also a difference in the number of programs. Around 75 accredited dental schools compared to roughly 160 MD programs and 43 DO programs. Yet, medical school applicants still apply to an average of 18 schools, while dental applicants apply to only 6. In other words, the paths attract different applicant pools and require different thresholds. A higher acceptance rate doesn't automatically mean that one path is less competitive, it's just one variable amongst others. When you factor in GPA, acceptance rate, percentile on the DAT versus the MCAT, and the extracurricular rigor, it's clear that medical school is significantly more competitive. But that brings us to the length of training. Most dentists can practice immediately after dental school with no residency required in most states. While specialty training is optional, it's not required for independent practice, unlike physician residency. Physicians must complete 3 to 7 or more years of residency before practicing independently. Basically, a dentist can begin earning a full professional income years earlier, while physicians spend those same years continuing supervised training and progressively taking on more responsibility. That means a general dentist can earn a full income 3 or more years earlier, which matters for debt payoff, compound interest, and quality of life. Dentistry offers earlier earnings and the opportunity to own a practice. Medicine offers broader flexibility and higher income ceilings, but with longer training and delayed payoff. This isn't about which path is better, it's about understanding the trade-offs before you commit. All right, so how does this relate to my decision between medicine versus dentistry? I've always been drawn to things that are more challenging, that are less compromised. But even on a subject matter level, even when I was younger, I remember having these 2 books, one about the brain and one about the heart. And they would walk you through the physiology of these systems, and I was completely fascinated by it, completely engrossed. And that curiosity about how the human body works, it never really went away. One of the things I loved about medical school is how deeply and broadly you study the human body. You learn physiology, pathology, pharmacology, and how all these organ systems interact in a level of detail and comprehensiveness that's hard to replicate anywhere else. Dentistry focuses deeply on a specific region, which is incredibly important. But medicine gave me the breadth of the entire human body, and that mattered to me. And the fact that the training was longer and more rigorous actually reinforced that. And once I understood that about myself, dentistry simply stopped feeling like the right fit. But now, what I didn't like. Before I get into personality fit and training structure, there were also practical considerations concerning dentistry that mattered for me personally. As some of you may already know, I was diagnosed with an autoimmune condition at the age of 18. And dentistry involves constant exposure to oral pathogens, and hand-related infections are more common than people realize. And given my autoimmune condition and compromised immune system, I was obviously cautious about specialties with higher infectious exposure. For similar reasons, emergency medicine also was not a good fit for me. It was one of several smaller factors that nudged it further down the list without it being the major deciding factor on its own. But small factors do add up over time. And career decisions are often made through accumulation, not just by a single big green or red flag. But that brings me to number 2. It never really inspired me emotionally. It wasn't something I felt drawn to growing up. My exposure was cavities, cleanings, routine dental care. That was kind of it. I respected the profession and it made sense logically. It checked a lot of boxes, but it never inspired me in the same way physicians and surgeons did. The emotional pull matters more than people think. My exposure shaped how I saw it early on, and some of that also came through friends in college. Several pre-dental students were originally pre-med, like that roommate's girlfriend that I mentioned earlier that I was helping with the DAT. And after 2 years of college, she realized pre-med was just a little bit too challenging, and she didn't want that added length of training with residency. Dentistry turned out to be a great fit for her. And watching that solidified something important to me. People aren't just choosing between careers, they're choosing between lifestyles, risk tolerance, and the kinds of problems that they want to solve every day. And interestingly, the same things that made dentistry appealing to her were the things that made me hesitate. Choosing a career because it's more attainable rather than because you're drawn to it can backfire in the long term. Because once you realize your career is something you'll be doing for 30 or 40 years, you start thinking about sustainability very differently, not just emotionally, but physically and cognitively. Is this something that I would be thinking, what if, in the future? And I've always believed that you should take pride in your work and try to do the best you possibly can, not because someone's watching, but because of your own sense of satisfaction with the work itself. That pride, that self-esteem. And this actually reminds me about Japan. One of the reasons I love Japan and why the culture just fits my personality so well is this obsession with mastery in almost every profession, whether it's chefs, craftsmen, mechanics, artists, car designers. They take their work seriously and they're constantly trying to improve and be the best at what they do. It's very much the antithesis to what I see a lot of in America, which is clock in, clock out, do the bare minimum necessary, and it's just a job. And that mindset that you see in Japan, it's very much resonated with me since I was younger. And when I went to Japan for the first time at 33, whatever years old, I felt like, wow, this place gets me. But this point isn't about the profession because you can take that mindset to either dentistry or medicine, but it's on a personal level, right? What is the thing that I'm going to want to put my soul, my effort, my life's work into that I'm going to constantly want to improve and perfect and keep refining. And I know hundreds of doctors, right? And I have met some physicians who are incredible and embody that pursuit of excellence, but also met others who just clearly are going through the motions, clocking in, clocking out, and not taking the best care of their patients. And I did not want to be that person that just clocks in and clocks out and does the minimum. It's just not aligned with who I am. I wanted to push myself and understand things deeply and do the best work that I possibly could. And that same philosophy extends beyond work. It applies to how you take care of your health too. In careers where performance depends on your body and focus day after day, small issues don't announce themselves. They compound quietly over the years, especially when the default mindset is to just push through and assume everything is fine. And that's one of the reasons I work with Merrick Health. Their approach is comprehensive and personalized, built on understanding what's actually going on physiologically, rather than assuming everyone can sleep, eat, and recover all the time perfectly. They look at factors like hormones, recovery from injury, body composition, sleep, cognitive performance, thyroid function, and overall health markers, and then build a plan around your real constraints, not an idealized routine. What matters to me is that it is physician-guided and data-driven. You're not guessing, and you're not chasing fixes in isolation. It's about seeing the full picture and adjusting over time based on how your body actually responds. That kind of approach matters when you're thinking long-term. Not just about getting through today, but about what you can realistically sustain over decades in a physically demanding profession. You can check out Merrick Health at merrickhealth.com and use code JABAL for 10% off. But even after accounting for sustainability, income, and long-term performance, there was something deeper I couldn't ignore. One thing that's easy to miss early on is when you actually have to decide. Choosing dentistry isn't like choosing a medical specialty. You don't go to medical school first and then figure it out later. To become a dentist, you have to commit to dental school specifically. That decision happens by the end of college. And realistically, even earlier than that, because you need dental-specific exposure, shadowing, and experiences on your application. Once you choose dentistry, you're on a much more defined path. There are dental subspecialties like orthodontics, endodontics, oral and maxillofacial surgery, and prosthodontics, but they're still much more narrow in scope and not nearly as many options as there are in medicine. And if you want to see just how many different paths you have if you go the medical school route, we have over 50 videos that break that down in the Med School Insiders So You Want to Be series, which you can find linked below. The structure of medicine is quite different. You go to medical school first, you rotate through tons of specialties, you get years of real exposure before locking anything in. And most importantly, you can change your mind based on what you actually experience. Dentistry requires an earlier commitment, which can be a great thing if you're certain. I valued having more optionality, and I wanted time to explore before committing to a specific path. This didn't make dentistry worse, it just made it a worse fit for me at that stage. And the final reason, dentistry and medicine are constantly compared, and for good reason, given patients, procedures, and anatomy. But they're solving fundamentally different problems. Dentistry is depth within a defined anatomical system. Medicine, by contrast, spans the entire human body and the interactions between multiple systems. They demand different wiring. But medicine also includes subspecialties that push that complexity even further. Fields like plastic surgery, for example, involve reconstructing entire anatomical structures, transferring tissue across the body and restoring both form and function. For me, limiting my work to a single anatomical region, no matter how important, felt less like focus and more like constraint. I wasn't looking for contained mastery. I was looking for expanding complexity. Dentistry was never really on my radar once I understood that about myself. And finally, should you choose dentistry? Dentistry can be a great fit if you enjoy hands-on, fine motor work in a contained procedural environment. It's also great if you value predictable hours and practice ownership, and get excited by oral health and patient-facing care. It may not be a great fit if you're only considering it as a fallback and lack interest in dental work itself, and definitely not if you're drawn more to broader systemic disease or surgery. There's no lesser path, but there is a wrong path for you. If, after all this, you still think dentistry could be a good fit, take a deeper dive into the career by watching our So You Want to Be a Dentist video. It covers what the day-to-day life of a dentist entails, how to get into the field, and the myriad subspecialties you can pursue. Watch that video right here.